asking me to tell you about this quote by Julian Hart, which was, I'm going to paraphrase here, that the availability of good medical care is inversely proportional to the need for it. That's not going to change, you know. So, what are the roots of that rule? You know, the roots would be that people who are the most vulnerable are least likely to be able to have the resources to speak for themselves, that they depend from other people to notice their problems and denounce them and do something about it. So, you know, these are some of the roots. And I think that when we're thinking about children, whether it's in this country or in the rest of the world, there's a lot of vulnerability for people who really literally cannot speak for themselves until a certain age, and then are dependent on caretakers, etc., to speak for them. And then we're talking about, for the most vulnerable children, caretakers who don't have the resources and strength to also speak for themselves. So, what can we do about it? You know, back to my initial comment. I think we can be more outraged about it, number one, and then we can be pushing. We can do more push for change. So in a sense, one of the things I will tell you is that sometimes as a child psychiatrist, I look at money collection that is made, for example, for children with cancer, or for people with heart disease, or for breast cancer in women, and I am reminded that our disorders are as devastating and not necessarily gathering the same kind of attention. And so the solution to that is going to involve people who have these disorders and who become passionate about making other people aware and have the courage to in a sense defy the stigma that comes with that, but also the doctors who take care of these disorders, understanding again that some of the need to raise public awareness and raise resources, etc., is going to need to come from us.